We will maintain for as long as practical a dual approach where we continue these measures of aggressive containment to this disease, but also employ strategies to minimize the impact on our communities. However, current global circumstances suggest it's likely that this virus will cause a pandemic. Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected and how many of those will develop severe or more complicated disease.
And I think people are a little confused. On one hand, you have the president saying, I think it's going to be under control. Mr. Kudlow saying it's tightly contained. You have Senator Graham saying it seems to be getting worse, not better. And the CDC saying that Americans need to prepare because this might get bad. Which is it? And what exactly do they need to do to prepare?
We're trying to engage in radical transparency with the American public as we go through this. Each of those messages is accurate, but addresses a particular aspect of what we're talking about. So, for instance, abroad, this is spreading quite rapidly. In the United States, thanks to the president and this team's aggressive containment efforts, this disease, as Dr. Schuchat said, is contained. And we've always said we expect to see more cases. We don't want people surprised if they see more cases here in the United States. That's an important part of transparency. People shouldn't panic when they see new cases. They should know their government predicted we would have them, and we have plans in place. We actually have tools. We may not yet have a vaccine or a therapeutic. We have public health tools of mitigation that we can and will use, and it's important for people to know we aren't helpless. We have tools. We have, as Dr. Schuchat said, we have actually a defined playbook for taking steps to help if we do see community spread.